Stiles. I'm the president of Dysautonomia International, and I'm very excited to be joined by two amazing women who are our special guests for this evening. Jane Taft, who is the founder of POTSibilities Parents. She is the official mom of everyone with dysautonomia. and Charlotte Florez, who is Dysautonomia International's new community engagement coordinator and a longtime volunteer who's been running some of our support groups for a very long time. So thank you, ladies, for joining us. We're going to go through some questions that cover topics that we are asked about a lot by dysautonomia patients and caregivers. And then we're going to take some Q&A from the audience. In the Zoom tool, if you hover over your Zoom panel, towards the bottom of the screen, there's a Q&A button. If you're watching on mobile, it might be in a different place, but if you're watching on a desktop or laptop, it'll be on the bottom. There's a Q&A button. You can type in questions at any time. And at the sort of second half of the session, we will take questions from the audience as best we can. So we're at 169 participants, so I think we can get started. Charlotte, if you want to do our first question.
Yeah, and we also have one more thing to remind you of. If you would like a live transcript, scrolling on the bottom, you'll see there's a little emblem that says live transcript, and that's what you pick if you want it to be translated as we speak. All right.
Charlotte, where is that? I actually don't see that on Zoom.
It should be at the very bottom of the page.
I'm not seeing it there. But if for any reason it's not working for anyone, we will provide the live transcript after the meeting. Maybe mine is just not set up to do that.
I think I just turned it on.
Oh, there you go. Awesome. Now it's there. Okay, the little CC button for live transcript. Great. We want to thank Vitasium, is one of our generous partners and sponsors throughout the year. They help make events like this free for all of us. Charlotte's controlling the slides. You want to go to the next slide? It's a team effort.
All right.
All right, great. So how do I tell a doctor about all of the things that are going wrong in my body without sounding like a hypochondriac? So Jane, do you want to take this question first and maybe tell us a little bit about your experience in dysautonomia, how long you've been part of this rodeo?
Oh, sure. Well, thanks for having me. We started down this path when one of my kids developed gastroparesis in 2007, and then POTS. And I started POTSibilities Parents in 2011, or 2012. Yeah, so it was really important to me to try to help parents connect with each other and reliable information and support. And so that's what I try to do. So this question, actually, the first thing that struck me is that a doctor who understands POTS will understand all of these things are happening and not think you're a hypochondriac. And if they don't understand that, they're probably not a doctor who understands POTS, because it's really typical with POTS to have a lot of different symptoms. And there are so many different conditions that might be associated with POTS, like EDS, mast cell, GI dysmotility. So a doctor who knows about POTS knows this.
Yeah. Charlotte, what's your take on it?
Yeah, so a little bit of my background is that I have been sick with neurocardiogenic syncope and POTS for the past 10 years. And I think it feels so overwhelming because there's so many things that feel like they're just going wrong at once. I think as a patient, what you can do to help guide that conversation is to spend a little time before your appointment and really think through what is going on in my body. Maybe list out the different systems and be clear about where you have issues and what your symptoms are. And then when you bring that to a doctor, instead of just saying, everything's broken, help, you can be more specific about what symptoms you're having and where you need help.
Yeah. So my take on it, I've had POTS for over a decade as a result of Sjogren's syndrome. And I think sometimes just acknowledging your concern to the doctor, you could say, I have all of these symptoms going on all over my body, and I don't want to seem like a hypochondriac, but I want you to know what's going on so you can help me figure it out. And sort of, maybe not just busting through the door with your 400 symptoms on the list, sort of talking about it. Like, there's a lot going on, doctor, and maybe if it can help you, because I know for me, when I was going through the diagnostic process, it was totally overwhelming for me. Forget the doctor being overwhelmed. I was overwhelmed. Making a list of what are your most troubling symptoms and really focusing on that. And also having a realistic expectation that if you go to your doctor for the first time visit, they're not going to be able to fix all of those symptoms in one visit, right? So what are the most pressing, concerning problems that you need to figure out? And then keeping in mind, hopefully, that you're going to have some long-term follow-up care, if not with that doctor, with some doctor, where you can start to put the puzzle pieces together on all of your symptoms. So let's go to the next question. This is a good one. All right, ladies, why is there such a long waiting list to see these specialists? Let's get your take on this. Charlotte, we can go first on this one.
I think the simplest answer is because there are experts and because there are not enough experts in the world. And so it's just going to take a while if you really want to see one of the top people to be able to get that care. I've also found that the experts really spend good time with you. And so this isn't just going to be a 30-minute appointment that they can book a ton during the day. They can only book certain appointments to really give you that attention.
Yeah, Jane, what do you see in the pediatrics? It's even sometimes harder to find specialists. There's fewer pediatric experts.
Yeah, and I think it really does come down to finding a doctor who is good and they are going to be worth the wait. That's going to be somebody who understands POTS and knows how to work with it. I think about getting in sooner. I guess it depends on if this is the first appointment or perhaps a follow-up appointment. I think it can be really surprising to go to the doctor and find out that your next appointment isn't for 6 months. And for that, it's just really, again, I think the issue of so few doctors and a lot of patients. And also just that the world of chronic illness is a different world than we're used to. And it takes a while to try different therapies. And it's tough, but sometimes there might be a cancellation list so somebody can get in sooner. And it's a conversation I think to have with the doctor about what to do if something concerning comes up in between appointments.
I'm noticing people are typing questions into the chat feature, but we're trying to use the Q&A tool to do the questions. It's a different button on the bottom of the Zoom panel that says Q&A. That will work better for us as moderators. So my take on this question is there's such a long wait list because there's too many dysautonomia patients and not enough specialists. I know that frustration well. I lived it myself. When I first got sick, a friend of mine was a neurology student, neurology resident at Mayo Clinic. And she said, "Oh, we pretty much invented dysautonomia. You can come here." This was 11 years ago. And so she tried to pull some strings and get me in, sooner than later, which, I probably shouldn't admit that, but everybody would do that for, if you had connections, you would try to get into when you were, acutely bedridden ill. And even with her connections, they put me on a wait list that was 3 years long to see Dr. Sandroni, who runs the autonomic lab at Mayo of Rochester. And so I was like, 3 years, I'm bedridden. My GI tract doesn't work. I can't wait 3 years. And we didn't know what I had at the time. We knew it was an autonomic problem, but we weren't really sure what. And I thought, I'm either going to be better or dead in 3 years. Like, I can't wait that long. So I ended up going to Cleveland Clinic. But that frustration, funny enough, it's easier to become friends with Dr. Sandroni and have a margarita with her than it is to get an appointment, because I ended up launching Dysautonomia International before that 3-year appointment came due. and she joined our board, and we had conferences, and I forgot about the appointment. And then I got a letter in the mail, like, your Mayo Clinic appointment is available next month. And I was like, oh my God, I don't need that anymore, because I had already gotten figured out somewhere else. But, you know, even the really good doctors, sometimes patients get mad. You know, why does Dr. So-and-so not do follow-up care? Or I can only get in to see them once a year. And it's really, many of the major autonomic labs that do formal autonomic testing have made a policy decision that their goal is to help as many people as possible get diagnosed, and that they just don't have the bandwidth to do real follow-up care for a lot of people. They tend to do more follow-up care for the very local patients in their area, but not always. And it is restricted. It isn't, you know, you can come in once a month. It is, because there's such a large number of patients, that is something that's a hard decision. It's not what they want to do. They would love to have, you know, 20 doctors on staff working with them, but most of them have minimal support from their universities to even see us at all. So maybe, well, I would say one suggestion to get on the list to be seen sooner is to ask, you know, when you call, ask the receptionist, does Dr. So-and-so have a cancellation list, a wait list? And can I be put on it? And not every doctor has that, but some of them do. And some doctors, you know, even if you called once a month to see, did anyone drop off the cancellation? You know, did anyone cancel? Especially if you live close by, or you can go there in a jiffy, you could tell them, you know, you can call me, I can be there in 4 hours, you know. Mm-hmm. So, and I would say sometimes the medical office staff drives us crazy, right? As patients, it's their job to sort of protect the doctor from the onslaught of phone calls from the patients. But being extra nice to the staff and kind of kissing up a little bit, sometimes you can make friends with them, and they can be like, oh, well, you sound really nice. You know, it's not easy to do. Sometimes you want to strangle them, but a little, you know, you get more bees with honey than fire. So, or what's the saying? You get more bees with honey than vinegar, I think is the saying. Mm-hmm. So trying to just, you know, be patient, and like, they know that you're sick, and they're trying to see as many people as they can. All right, let's go to the next one. How can I remember and keep track of what the doctor and I discussed when I have such bad brain fog? Jane, how do you deal with this?
Write things down. Oftentimes I'll just whip out my phone, and I always apologize because it might look like I'm going on Facebook or something, but I'm not. I'm just taking notes. You know, another option would be to bring somebody to take notes for you. And that way you can concentrate on the appointment and let somebody else do the record keeping. I think too, it can be really helpful to ask the doctor to, you know, kind of send a clear summary of the discussion and the plan. I think some doctors put more into that than other doctors do, but just having it really laid out. I know sometimes I'm like, okay, what medicine was that? How much was that supposed to be? You know, it's really great to have it laid out like that. And then honestly, I think it's a good idea to do things like just little tricks that people have, you know, if you can tolerate compression, you know, if you can get an appointment for a time of day that is better for you and your brain fog, you know, things like that might help too.
Yeah. What about you, Charlotte? What's your game plan on that?
I mean, that is spot on, exactly the advice I was going to give. As an adult patient, I often bring my mom with me because she's free during the day since she's retired. And sometimes I feel like maybe that makes me look like I'm not as competent because I have to have another person with me. So I usually make sure I advocate for myself and say to the doctor, sometimes I have a little bit of cognitive dysfunction. So my mom's here to help me kind of take notes and understand everything that you're saying. But then I make sure I maintain kind of control of the conversation, and that the doctor sees me as the patient who's really running things instead of making it seem like I'm bringing a squad with me to the meeting.
Sometimes you need a squad. But when I was going through the, you know, very challenging diagnostic process, I figured out, which made me pretty angry, that I was taken more seriously when I had my husband with me, and he would vouch for me. You know, this is like, it's shocking that this is well, this was 10 years ago, but still, you know, or in the 2000s, that should not be the way it is. But in some medical centers, you know, that is the way it is. And at the end of the day, as much as I want to be a feminist advocate, I also need good medical care. So if I have to bring someone with me to help validate that what I'm dealing with is really what I say I'm dealing with, then I will. And then having him there was helpful. Although I would yell at him because he would say stuff like that was not helpful, like that he didn't think it was making it unhelpful, but he'd be like, what? I'd be like, I can't believe you said that. So maybe have that discussion with your spouse or your partner or whoever's coming with you to like just kind of hang out in the background and don't talk. So, okay, let's check out the next question. Oh, that's the $1 million mystery question. Jane, how do you deal with that? And I know this has definitely been an issue at some of the pediatric doctor offices.
It is, and I think it does come down to the same issue that we were talking about for the long waits. I think they are really, really busy and really doing their best. And it's actually, you know, I think it's one of the factors that we need to consider when we're trying to decide if this doctor is going to continue to be a good match for us. You know, if we have a difficult time communicating effectively, then that might be something where it's just not worth it to continue there. I mean, one way to deal with it is try to get everything handled during the appointment that you can. You know, try to think of any questions that you might have, bring any forms that you need to get filled out, try to bring them with you and get them filled out right then. And of course, that's not always possible. Things come up in between. And, you know, I think it's really important as well to think about things that you might need to talk to the doctor about, or at least one of the staff, before you need to, and find out what you should do. So if it's an office where it's hard to get a reply, then I would suggest really having a you know, clear conversation with the doctor. What do I do if I get a new symptom? When should I go to the ER? What do I do if I have a bad reaction to the medication? Should I keep trying it? You know, just try to get all these things laid out beforehand, and it might make it possible to continue that particular working relationship, you know, because sometimes the doctor is really good and really dedicated, and it's just kind of hard to hear back.
Yeah. What are your thoughts on this, Charlotte?
Yeah, I like to try to ask my doctors how they would prefer for me to communicate with them, because some doctors just are not as big on the my chart messaging. And I think in the social media age that we're in, it can feel kind of tempting. Like, I've got this direct access. Let me just text my doctor, I'm having this symptom, I'm having this symptom. So I try to think through using that sparingly, and only when I really am having a big issue contacting my doctor. And then I've had more of an issue with this when I'm trying to get paperwork filled out. And I found really the best thing to do is I just have to go in person. I have to go in person and say, this is the paperwork I need, and kind of bother them. It's really obnoxious because you're working on limited energy to begin with, but just continuing to follow up until you get what you need.
Yeah. I did want to share a little bit of sort of information we've heard from some of the very popular, like really good dysautonomia doctors. So I won't say which doctor this data comes from, because I'm not trying to cause any trouble for anyone, but there's a very beloved dysautonomia doctor who was told by their department that, you know, you are seeing 2% of the patients in this department, but your dysautonomia patients are leaving like 90% of the voicemails and my chart messages. And it was causing such a huge, overwhelming burden to the staff and to the doctor, that the doctor ended up, you know, leaving that clinic and became not available to our patient community. So I've talked to this doctor and I said, well, was it everyone, or was it just like some patients just messaging you like 100 times? Like what, you know, like how did it end up like that? And the doctor said to me that they loved seeing dysautonomia patients, and they really, there are someone, I'm not going to say who it is, but everyone who knows this doctor loves this doctor, and they do a lot for our community, but they were getting just overwhelmed. They said there's some patients and parents that would message them 15 times a day. And if they didn't message back, they'd say, oh, I'm reporting it to your boss and your department chair and then the hospital, patient advocate's office. And I'm going to report it to the Joint Commission, and kind of like patients really like kicking it up a level. And I said, are these like urgent messages? Like someone's in the hospital having a heart attack? Like what are the messages? And they said, sometimes people would be saying, I jammed my finger in the door and I have EDS. Should I go to the ER? And this doctor was like, this is not even a EDS expert. This is someone who's just, a good doctor. So I feel like what I took from the conversations with this doctor was that it's not everyone in the dysautonomia community doing this, but there is a sort of vocal minority of our patients who maybe don't have the coping tools to know how to deal with some of their stuff at home. And maybe that's more likely people who are newly diagnosed or who really haven't had access to a good doctor in the past. But I think as a patient community, we should be mindful of that when we're leaving lots and lots of messages for a doctor, eventually that staff at the doctor's office you're not the only patient doing it, like there's other people. And I really worry because we've seen a couple of autonomic labs and good specialists have to close their clinics. So I know Jane has thought about this a lot too. Do you have any thoughts on that issue?
Yeah, I think the one thing that occurred to me is that I think we kind of go through different stages working with medical professionals when we're dealing with POTS. The first stage, which we know is trying to find a diagnosis and takes an average of 4 years. During that time, we are having to advocate and to fight and try to get somebody to listen. And, I wonder if some of that we might carry into the relationship that we have with the doctor we're going to continue with, thinking that we need to really kind of push to get an answer. And it's a really difficult thing. And I think too, I think I usually tend to think of, from the parent perspective, and from a parent perspective, going into the world of chronic illness, it's like flipping a switch. And the things that we were responsible for getting checked out by a doctor right away before the world of POTS, that switch is flipped. And we are in this chronic illness world where suddenly these things are actually, these symptoms that are so life altering are expected. And they're going to take a long time potentially, to get under control or to get a bit better. And as parents, and I hope people are doing this for themselves too. I try to hold myself to the same standard as I do for my own kids. Like if I would take my kids to the doctor, I should take myself to the doctor for that too. But specifically for parents, when we are in charge of our kids' welfare, it is a whole different world where we are supposed to kind of step back, wait, let things kind of play out, try different things. As Dr. Boris always says, POTS is a marathon, not a sprint. And I think that's one of the hardest things, to come to terms with or to even be told. And I hope that on the doctor's side, that the doctors are comfortable telling patients and telling parents what they should do and where things are now, because I think a lot of times people don't know unless they've been told. It's a tough thing, but I think that, fighting for an answer with a doctor that we want to maintain, really good, positive working relationship with, that is not necessarily going to be productive.
Yeah, I think a lot of us have gone through bad physician relationships, like sort of like, you know, we've been in some abusive physician relationships
Absolutely.
or just where we got hurt, you know, because the person didn't care or told us or blamed us for our illness or gaslighted us or just didn't
Yeah.
have any help to give, even if they were nice. And so I think we take that and then we go to a doctor who really is awesome, that wants to help us and knows what they're doing and has like a process, you know, of how they do this for people. And we maybe sometimes have very high expectations because you've been through so much. By the time you get to a good expert, you think, oh, now I'm going to see, I'm giving an example. I'm going to see Dr. Goodman and he's going to know everything and he's going to figure everything out and I'm going to get better. And it isn't always that simple, right? Even the really good doctors don't have all the answers or magical treatments for us. And so making sure that you don't take that negative experience you've had, almost like a trauma that you've had from dealing with prior doctors, and don't put it on the new doctor. Like, don't assume the new doctor is being like that too. Especially if they're one of the dysautonomia experts, it's probably because they're just totally overwhelmed. And I can't imagine, you know, running one of these autonomic, like, look at how many patients are on our support groups. And that's only like part of the dysautonomia population. And we can only think of maybe like, you know, 20 like really big, really good autonomic labs around the country. And then in other countries, it's even smaller numbers of specialists. So they have the weight of the world on them. I'm trying to help people that are desperately in need of help. So anyways, I would just say, yes, we're very disgruntled about other doctors not helping us, but when you find a good doctor, try to be a little patient with them and realize that they're human and they have a wife and kids and they get sick and they, you know, they have things they're dealing with too. And so they're not necessarily ignoring you. They're just drowning, you know. I mean, if they really are ignoring you, then you got to jump ship. But let's go on to the next question. We talked about that one for a while.
Yeah.
My medical history is long and complicated. I think any of us could have written that. How do I summarize it without overwhelming myself and the doctor? The 30-second elevator pitch version of your diagnosis. How do you make that? Charlotte, what's your strategy for summarizing your giant long medical history in a nutshell?
So I think it helps to look at any big events that have happened in your life. Doctors for a snapshot want to see, oh, did anything seem to trigger this? Were you healthy until this point? So I look at that and try to make sure I'm communicating that clearly. And then for my actual medical files, I think like many of us, I have 2 volumes of giant medical forms and files. And what I have done is I went through and just tried to compile that all into, in this year, here are the tests I had done, here's what medicines I tried, they didn't work, so I moved on to this, here's any new diagnoses I got. And I color coded mine because it was just easier for me. And my doctors have responded really well to that. And they've said, oh, this is helpful because I can just scan through it and kind of see if you've been on this medication I want to try. It's also helpful for me because I can't always remember what medications I've been on. So having that document has saved me numerous times.
Yeah. Jane, how do you organize your, and you don't you, I think you have multiple children who have
I have
dysautonomia
multiple
stuff,
children.
so
Yeah. Thankfully, they are now young adults and can really be in charge of this themselves. I love the idea of color coding. I think that's great. That's not something I've done. In this respect, I think even just having a little, like if you're going to a new doctor, maybe a bulleted list of kind of the main things, or even by system, like these are the main GI things, these are the main, headache things that seem to set it off. It's just having a little kind of shortened version, and then we could have, the backup information if they need more information for it.
yeah. Since we're about halfway into the webinar, let's jump over to the Q&As, questions people have typed in. And so I just want to give the disclaimer that the 3 of us were not doctors. So We can't tell you like what dose of beta blocker your kid should be on or something like that, but we'll give some, we'll do the questions that are sort of things that can apply to everyone, you know, large numbers of people, and that are sort of on topic for the webinar topic as much as possible. So if someone who is newly diagnosed, it says, you know, what kind of doctor or what kind of testing should I be asking for if I have POTS? I don't even know where to begin to start finding answers. So I think that's a common feeling that we've all been through, if whether you have POTS or even another form of dysautonomia. So Charlotte, where do you advise people when you're working on the support groups with so many people, and Jane's on other support groups with so many parents, you know, let me ask Charlotte first, where do you advise people to, you know, how do you navigate this?
Yeah, so I normally refer people to Dysautonomia International's doctor list. We have it split up by state. And so you can find someone who's local that way. If you have the money and the time, we definitely suggest seeing an autonomic neurologist. If there's not one in your state, you might have to travel to do that. But locally, I've had better luck with cardiologists. So I start with a cardiologist in my area, and then they helped connect me with the right answers. I also got tied into a lot of support groups, and that helped me just get a pulse on what's normal for this condition, what might be unique to me, and helped equip me with better language to bring to my doctors.
Yeah. So in addition to the main, we have a Dysautonomia International website list, and it's not meant to be every and any doctor on the planet that sees dysautonomia patients. The doctors initially got on that list by being recommended by multiple patients and having sort of some recognition amongst the other medical experts as being someone who is interested in diagnosing and treating a wide range of autonomic disorders, not just POTS. Of course, doctors move, they retire, they die, they change their practice focus, they decide to become a doctor that does plastic surgery. I mean, whatever, we've had every kind of change on that list over the years. So it's really hard to maintain that list and keep it accurate. But we try our best, and we welcome if people have corrections for us, you know, someone retired or died, we'd love to know. We try to reach out to the doctor's offices once a year for an update. If there are other doctors that you want to add to that list, the doctor themselves has to contact us, because we do a phone interview with them to sort of understand their practice philosophy. And we also require a copy of their CV, which is like a sort of sciencey resume, to make sure they have adequate training to actually see our patients. And then we, besides that one list, we also have in all of the support groups in the all 50 US states, several Canadian provinces, and an increasing number of other countries. We encourage the local patients to create a list of not just MD doctors, but any healthcare professional that was helpful to them, whether it's your gynecologist, your physical therapist, the psychologist, a counselor, an acupuncturist, you know, anyone that was helpful in their area. So that should be in all of our state and province-based support groups. That's pinned to the top of the page as a physician or clinician recommendation list. Anyone you can recommend, clinicians you've seen. You could leave feedback if someone says Dr. Smith was great and you were like, I don't know, Dr. Smith wasn't so great. So you can kind of provide some feedback on whether you agree or not. And collectively, we kind of come up with a list for the regional doctors that are helpful for us. So Jane, I know POTSibilities Parents, the parents trade notes on all the pediatric doctors.
Yes.
Who's the best, who's not the best. So I'm sure you have some other resources that you probably have developed on that too, right?
I think a couple of different things. I think word of mouth is invaluable. I think it's the best way to start looking for a good doctor, because at least you know that somebody else in the POTS community has found that doctor to understand POTS, to be good with POTS. It may not be the best match for everybody, but I think it's a great place to start. I always recommend that people go to DI's state groups and the website, of course, but the state groups for that reason. And then people often in my group just post asking. And even though we have a document with like a list of pediatric specialists, people tend to come out of the woodwork when there's a parent needing help, and asking for specific information. And I think about, for things like the type of testing that people should have, I think doctors vary so much with what they look into. And when you're newly diagnosed too, it can be pretty overwhelming to see all the different things that might be going on. But I think it's really helpful to have, just kind of a list of things to be aware of that parents or, patients can look into themselves. Like, is your child bendy? Well, maybe they have EDS or just hypermobility. GI issues, a lot of times people are told it's anxiety. Well, if they have POTS, then there's, not a bad chance that they've got something GI going on as well. So again, it seems to be, a lot of word of mouth. I also always refer people to that, the POTS issue of autonomic neuroscience. I think that is super helpful. And of course, DI's Vimeo page. And even though for somebody who's new to this, that might be a lot if they go through and look for a specific thing, if they're looking for migraines or for GI issues, there is so much to be learned from those top experts just right there.
Yeah. In terms of what testing to get, we're not going to get into all the super medical detail here, but if you're newly diagnosed, I would say, you've gotten a POTS diagnosis. So that's sort of important first step. And I don't want everyone to think we're only talking about POTS, because there's obviously people with other autonomic disorders too. But so you've gotten your recent diagnosis of a specific autonomic disorder, where sometimes, we recognize that there are some doctors that don't know how to pinpoint what type of dysautonomia someone has. So you might have been diagnosed with dysautonomia, which is by itself is not a diagnosis. It's sort of like telling someone you have cancer without telling them what type of cancer or where it is. You need to get the diagnosis pinpointed by a doctor who knows how to do that. But in any event, you don't have to wait to start treating the basics, right? And so I think when you're newly diagnosed, you should focus on developing a knowledge of the standard basic treatments, that a lot of which are things you have to do yourself. Salt, fluids, making sure you're getting good sleep, trying to figure out if different dietary changes might help you, whether that's eating fewer carbs that help some people, avoiding things that might give you allergic-like reactions, or just avoiding junk food, trying to eat super nutritious and healthy. And that stuff, it takes a long time to kind of get into new habits and try things to see if they work or not. I would say, when you're newly diagnosed, you probably don't need to jump down that rabbit hole of testing for every possible comorbidity. Try to get yourself as stabilized and as well as possible, using standard treatments. And, has your doctor started you on some basic medication? Not everyone needs medication. There are some POTS patients who get by with just symptomatic measures and exercise plans and stuff like that. But there are lots of people who need medication in addition to that. So I would start with getting yourself on basic treatment stuff. And if that is not getting you to a better place, then you can start, thinking about, do I need to be screened for EDS? Do I need to be screened for mast cell? Do I need to be screened for Sjogren's syndrome? Or I think importantly, I would want to be screened for small fiber neuropathy. And so if you're diagnosed through a cardiologist, they probably have not discussed that with you or even considered it, because cardiologists don't think about nerves, right? They think about hearts, which is, it's connected, but they don't necessarily do that clinically. So trying to see an autonomic neurologist, which there are only a few of, or a neuromuscular specialist who does small fiber neuropathy assessments. Not every neurologist does this. Headache neurologists might not know about it, or neurologists who do strokes all day long, they don't necessarily deal with small fiber neuropathy issues. You really want a neuromuscular or autonomic specialist. And if you have a small fiber neuropathy, then there's a whole different testing panel that should be done to try to identify the cause of that. Let's keep going on some other questions. Sorry, we're getting into the details on the questions, but hopefully people find this helpful. What if you already know what you want? How do you get a doctor to give it to you? It's so much work to get them to think it's their idea, and in this patient's experience, most doctors are not swayed by stacks of journal articles they show them. So Charlotte, what's your plan of attack for being artfully persuasive to your doctors to give you the test or the treatment that you want to try?
I think this probably depends on what treatment you're trying to get, but I know one thing you can do, IV saline is what came to my mind when I heard this question, is to prove that you've really tried the alternative and what they want. So show that you have tried to drink the amount of fluid they're wanting, that you've tried to up your electrolytes, or whatever it is that's their hesitation, try to prove to them, I've done everything I can to try to do that, and it's just not working, so we need to come up with an answer together. And then I have found that bringing data with me is helpful. It's not helpful if you say, I Googled this, or Susie on the support group said this. That's going to lose some of your credibility. But my doctors have responded well when I've brought actual data and research to them.
Yeah, I think for trying new treatments, saying things like especially stuff like saline or drugs that they might be a little concerned about prescribing, you can sort of say, hey, can I just try like a 1-week trial of this? Like I'm not saying I want you to make a long-term commitment, but let's just see if this does anything. And if it does, then we can revisit whether this is a good long-term plan for me. And so sort of letting them be non-committal about long-term treatment with it is sometimes a good way to get them to twist their arm a little bit. Jane, what's your approach to, being gently persuasive?
Oh gosh. I mean, to me, if a doctor is really resistant to something that I'm interested in, or think might be really beneficial. I mean, I guess there are a couple of things. I mean, especially if it's a POTS expert, then I think that's probably somebody who has a lot of experience with this, and maybe they can go into a little background information of why they think it might not be a good match for you, or why they're not comfortable with it. But again, it's one of those things to factor into whether this is the person who is the match for you. And it's tough because there aren't very many POTS specialists, and finding somebody, I don't know that we want to go looking for a specific treatment. I think it's more about kind of almost being a team, with your doctor, and wanting to be heard by your doctor, so.
Yeah. So here's another question I'm gonna go over with you guys. Sorry. Actually, so this is maybe not necessarily super on topic, but I think it's a good question and we can probably deal with it quickly. Has anyone tried physical therapy and had any luck? Is physical therapy used as a treatment for dysautonomias? And I think the quick answer is yes, it can be very helpful if you find a good provider. And they don't have to be, there are not too many PTs who are dysautonomia experts, but I think you want someone who's going to be compassionate and who's going to understand that they can't push you, because you need to sort of go at your own pace, what you're comfortable with. I also think that you want someone who's willing to learn with you, because they're probably not going to be a dysautonomia expert, but if they're willing to read some journal articles and learn, and maybe there are other PTs who are dysautonomia experts, maybe they reach out and talk to them. I think it'd be very helpful, but everyone's different, right? Some people say, I loved it. Some people said, oh, that was awful. You got to do what works for you, just like everything, right? Beta blockers don't work for all of us either, but they're used pretty often. So I guess I answered that one. I just wanted to, because it was a good question. So let's see. Jenny wants to know, is there any way to share this with our individual state groups after this evening, this webinar. There's great information. I'd love to share it with my group. Charlotte, what's our answer on that one?
Yes, so in the next probably 2 weeks, we'll have the video edited and uploaded onto our Vimeo account. It's vimeo.com/dysautonomia, and we can share it in the chat too. And it'll be up there, and then you can share it with your group. And this is a great way to start some discussions. You could ask your fellow group members, so what other tips do you have? What can you share? Because we are a wealth of knowledge. There are so many people in our community that have really creative, great solutions to problems. It's a great way to get connected.
Yeah, here's a Jane question from another mom. How can I help my 20-year-old daughter who's just been diagnosed with POTS and lives 1,600 miles away? How do I help her find compression gear, salt, water, fluids? What do I do to help her?
Oh, that's a tough one. It is really hard if they're just newly diagnosed and far away. I don't know if she's at college or just lives far away with a job. I guess how impacted she is. Sometimes those first line of defense options of compression and water and salt really help. And so maybe laying that out, kind of just giving her some bullet points of, that these are the things that might really help you start to feel better. But it's a tough one, because I know for my kids, one of the biggest things for being able to be at college was adjusting their schedules, and understanding that they couldn't stay up and drink all night like the other kids, that they couldn't stay up and study all night like the other kids, that they had to pick, really one important item to participate in, one important thing. And that was when they were really more stable. If someone is away at college, it's really important to get accommodations. And a lot of schools are pretty good about that. They're nothing like they are in high school, but you can get things like extended time for testing. You can even get a dorm that's centrally located, air conditioned, forbearance for attendance issues. There are a lot of things that can be helpful. And I think, given that, my experience is really more with, kind of school age and college age kids, I think one of the best things is for somebody's professors to get to know them and to show that they are a good student, and that they're not messing around when they can't make it to class or they need to turn something in late. And I think that makes a big difference.
Yeah, that's good advice. Here's another question. Does it look bad to keep going to different doctors of the same specialty? For example, I've already seen 2 rheumatologists who don't believe in lip biopsies for Sjogren's, while other doctors I see think I have Sjogren's and want me to get a lip biopsy. I don't want it to look like I'm doctor shopping. So what's your thought on this, Charlotte?
I think you're the patient. And if you are trying to get that lip biopsy, you do what you need to do to get it. And if the doctors are not helping you, then that's probably a good place to come back to your local support group too and ask, who has done a lip biopsy for anyone in this group? Where can I go to get this resource? I think it does look bad if you've seen a ton of doctors, but I also think if you're on a mission and there's something specific diagnostically you're trying to get, then it validates why you would continue seeing other doctors.
Yeah, I wrote a journal article with a few other patient advocates from Dysautonomia International that got published in the POTS special issue that Jane mentioned earlier. It was a special issue of Autonomic Neuroscience with 19 journal articles on POTS. And we wrote the article that was like, a message to doctors, like what POTS patients want you to know about us. And in that, we talked about that we need to get rid of the term doctor shopping now there is real doctor shopping. So that term generally is referring to people who are abusing drugs, usually, addictive substances, and they're going to multiple doctors to get multiple prescriptions at the same time for addictive medications. I do not think going to 3 doctors to try to get a lip biopsy for suspected Sjogren's is doctor shopping. In fact, I actually, well, maybe it is doctor shopping, but it is the best shopping you could possibly do. You know, we spend a lot of time shopping for a house and shopping for a car. Why shouldn't we shop for the best doctor? Like, you know, it's your health. Nothing's more important than that. So I think you should not worry about that. If you were really being kind of ridiculous and, you know, demanding a certain treatment and going to 15 different doctors and no one wants to give it to you. But if you have one doctor saying, I think you should get this test, I just don't know how to do it. The other thing I would say is go to that doctor who thinks that you might have Sjogren's and ask them to help you. Who should I go see? Can you call some colleagues? Who can order this test for me that you've suggested? Because I'm bouncing around and not getting anywhere. And that is a common problem with a lot of rheumatologists not being wise about lip biopsies.
Yeah, Lauren, another thing I think about, and I'm sure you know this off the top of your head, I don't know the number, but there's a large number of doctors that most patients have to see before getting diagnosed.
Yeah.
So if we all gave up after doctor number 1, where would we be? I mean,
None
it
of
makes
us would be
sense
here, probably. Yeah. So if for POTS, the average number of physicians seen before the POTS diagnosis was 7. For Sjogren's, it's probably just as bad. They have similar diagnostic delay numbers to us. And then, you know, for, I mean, I'll tell you guys my number. I don't talk about this a lot because it does make me seem like a crazy person, but I have lectured on it in the past. I saw over 100 doctors in 2 years. And then it was doctor number 116 that did the Sjogren's lip biopsy on me. I wasn't going to 116 doctors to get a lip biopsy. I was just acute onset illness, bedridden, GI tract not working, you know, and my doctor started sending me to every specialist she knew. And then they would say, I don't know what this is. Why don't you go see my colleague? And it kind of ballooned really quickly. And it was ridiculous, you know, like who sees that many doctors? I knew it was ridiculous. But I was on a mission to get figured out, and it took that many doctors to do it. And what's sad is like the thing that Dr. 116 did, who was an autonomic neurologist, Dr. Shamali, should have been done by like doctor number 4, you know, but they just didn't have the knowledge to do it. So even though I'm, you know, I'm a sort of fairly well-functioning patient, and, you know, I have good medical care, I'm still afraid to tell people this because I know it makes me sound like a crazy person to say I saw 100 doctors in 2 years. But that's the reality that some of us are living with. And I also want to recognize that I know not everyone can do that, right? There's a lot of people who have economic limitations. Maybe family can't take them all over the place. They don't have insurance that lets them see multiple doctors. So that's, you know, a huge privilege on my part to be able to do that. And it worries me about the patients who can't do that, who are stuck with one doctor who doesn't know what to do. So anyways, Jane, did you have thoughts on the doctor shopping idea?
I think by the time we get to a doctor who knows what's going on, like the doctor who knows you need a lip biopsy, that doctor understands that you've probably been to these other doctors who haven't given you the lip biopsy, you know, but it is a really tough process getting there. Yeah, but I just want to, you know, give a real shout out to DI and to, you know, all the support groups, because for people who haven't gotten a diagnosis from a doctor, it's invaluable to find this information, the scientific information from a reputable source, you know, and to kind of have this grassroots experience with other patients and other parents and caregivers, you know, to just that word of mouth, I think has made an extraordinary difference in the patient community.
Thank you. Well, you have too, by the way. You know, your work with POTSibilities Parents is very important, and we've always, you know, had a good relationship. We started around the same time, the two organizations.
Yeah.
So let's take our next question. I think this is a good one. I have a doctor that I like. He knew to test me for dysautonomia, but I suspect that there are some holes in his knowledge. I would like to stay with him as a doctor. Is there a thoughtful, careful way to talk to him about And they say, I don't know what the right words are to put it badly about what he might not know. So how do you help your doctor fill in their gaps in knowledge in a respectful, polite way that doesn't get you fired as a patient? Charlotte, do you have thoughts on that?
Yeah, one of the ways that sort of generically you can help build up your doctors is to share with them our CME courses. That's the continuing medical education, and really get them connected, because they need those courses anyway to keep their certification. So then if you can just gently nudge them towards learning more about dysautonomia and it benefits them, I think that's a great way to connect your doctors. Then personally with this, yeah, I think I would bring some resources. I would point them towards the Dysautonomia International website. But I think if you can physically bring a resource to them or send it to them through my chart, it's more effective than just generically asking them to learn more.
You're on the continuing medical education courses we offer, which are also, we almost always make them open to patients and caregivers whenever we can. Some universities want it to be just for the doctors, but we make it available to everyone. How do you say that to your doctor without saying like, you need to learn about POTS, So I think what you could say is, you've been so helpful with my dysautonomia, and I'm guessing you see other patients that have this. I want to let you know, Dysautonomia International has had these great conferences with all these research updates. So you're not like questioning their knowledge of the basics. You're kind of saying, hey, there's all this cool new research happening. If you're interested, here's a link to go watch these videos. So it's not any kind of degrading their knowledge, just sort of saying there's some new stuff, and then also another way I've done it is like, I actually bought my rheumatologist a book on Sjogren's. And I didn't say this is for you. I was like, oh, I got this great book. And so I had a second copy. So if you have other Sjogren's patients that want this book, I thought I'd leave a copy here as a reference manual at your office. And I gave it to him, and I was thinking in my head, like, please read it, please read it. And then he actually really appreciated it. And I didn't say, I want you to read this, but like the next time I saw him, he was like, I was checking out that book. It was great, So sort of, a little sneaky, but so, Jane, do you have tricks to unwillingly educate doctors?
Well, I think I really like the idea of coming at it in a positive way, so that, they probably might even be aware that there are things that that they could learn, but I love the idea of just saying, all these research updates, they've got CMEs. I think that's really, I think it's something someone would be receptive to.
Yeah. Here's a good one. What do you say when a new doctor says you're a complex patient?
Sorry.
What do you say? Okay, I laugh too, because we've all been told this probably at some point. Jane, what's your approach to dealing with that kind of, it kind of depends on how they say it, right?
Yeah, I think what we've heard the most in my family is, you're interesting, well, thanks. And actually, one time a doctor said something like that. He actually literally was a geneticist. He rubbed his hands together. You're so interesting. And then he was kind of appalled that he'd done that. But we really appreciated it, actually. We laughed with him because for somebody to find what was going on in our family interesting, somebody who might, at some point be interested in looking at where this might be coming from. I thought that was great. And, complex, I think we tend to sometimes hear people are complex from maybe somebody who's not necessarily as fluent, with dysautonomia, because a lot of people might kind of come to this thinking they're super complex. And don't get me wrong, I think probably most people with dysautonomia are kind of complex,
Yeah. I would also say we are not the only chronic illness that's complex, right? It's almost like that's the doctor's admission that they don't really know what they're doing. If they understood dysautonomia, they wouldn't really feel the need to say that to you, probably. But people with other diseases are complex too. We're not it feels unique to us, but there are lots and lots of people with very complicated medical conditions that impact all the different organs and systems in their body, and multiple overlapping conditions. So I wouldn't be too worried. If the doctor said it in a rude kind of way, then maybe that's a red flag that that's not a great clinician for you. But I think it's okay to acknowledge it. And I use humor a lot to cope with stuff during medical appointments, and be like, oh, like if they say you're a complex patient, I'd be like, yeah, it's never good to be the complex patient, like kind of acknowledging that like this is an unusual thing and I don't want to be this person, but it's what I am. So let's take another question. Let's see. Here's a tricky one. Do you have any suggestions for how to deal with doctors who keep trying to refer you to therapy, psychiatry, etc.? So I'm going to ask Charlotte that. I'm going to ask both of you, but Charlotte, you take that one first.
Well, I think it's good to look into therapy, because having a chronic illness is a lot. I don't think that always means that a doctor is telling you it's all in your head. I think sometimes they're saying, I'm looking at you as a whole person, and I see that you need support in this area too. So I think it's good to try therapy out and see if it's helpful in your progress. If they are a doctor that is just telling you it's all in your head and you're crazy, then I would say it's time for you to, if you've tried therapy and that didn't work or help you any, it's time for you probably to leave that doctor and try to find somebody who listens to you a little bit better.
Yeah. Jean, what's your 2 cents here?
Really pretty much the same thing. I think it depends on where the doctor's coming from. And again, kind of coming through that long period of time to get a diagnosis, that is something that probably a lot of us are potentially sensitive about, wanting to make sure that the doctor understands that we have this physical condition that needs to be addressed with physical solutions. But I am a huge, huge fan of therapy. I think having a chronic illness is really, really hard. It's hard on the person who has it. It's hard on the people who love them. And they're just like, it's a great place to learn coping mechanisms. It's a great place to vent. I think therapy is wonderful. Just one quick caveat though, it can take a couple of tries to find a good match. So if somebody's not a good match, if a therapist just doesn't seem like someone you can open up to or work with, try somebody else, because it's worth it when you find somebody who's a good match. But yeah, if the doctor thinks that this is all coming from, something going on, with your mental health, it's just, that is not a doctor who understands what is happening with autonomic dysfunction.
So I think that this is very much all about context, right? And I think it's really important that we acknowledge that there are lots of people who have mental health problems in the dysautonomia community. In the general population, a third of Americans have anxiety or depression. So then in the chronic illness community, especially when you add multiple chronic illnesses to the picture, or an illness that's so debilitating that you can't work or you can't go to school or you can't socialize like you normally would have, it's not at all surprising that a subset of our population actually really does need mental health support. And it doesn't mean that their whole entire illness is a mental health problem, but mental health is health, and I think as patients, because we're so often gaslighted and blown off and said, your whole illness is just anxiety, or you're just making it up or whatever, that we become super resistant to the idea that we might need some mental health support, or that we have some kind of overlapping psychological condition. But I think that it's really hard, because you don't want to work with a doctor who's blaming everything on it's in your head, but you might have some anxiety. It's sometimes hard to recognize it in yourself, and sometimes when you do recognize it in yourself, like I went through a period where I definitely was very depressed, thinking about suicide. I was in a bad place because I was going through such a difficult diagnostic process. And I was afraid to admit that to my doctors, because I didn't want to get gaslighted and sidelined even more than I already was. I felt like if I admitted it, then they just were going to take away my medication that was helping me for my dysautonomia stuff. So one solution that I came up with for myself was to go see a psychiatrist, or actually so a psychologist on my own, and just not even tell my primary care doctor about it, because I didn't want to get like the medical records crossed. Now it's becoming increasingly hard to do this because there's so many different medical systems that are all looped together now, right? And now, you know, in some respects, that's good that there's shared medical records, but then it also makes it harder to sort of do things independent and not have your doctors know. But, you know, I don't think it's something to like have a reflexive, instinctive, like angry reaction to. Sometimes mental health support is helpful, even if you don't have an actual psych diagnosis. Just going and learning about some coping skills, techniques, or things, or even just to sort of appease the doctor. Like, yes, I tried it and it didn't help. You know, I actually had a psychologist after 3 visits. He wrote a note that said, you know, this patient needs a better medical doctor. This is not a mental health condition. I was like, I'm putting that in my back pocket, you know? So sometimes the psychologist sort of validates that what you're dealing with is not simply a mental health issue. Okay, I think we can probably do one more question and then we should probably wrap up. Let's see. This is a related question, actually. How do you navigate getting help for physical issues when you have a severe mental illness history in your records? And that's all the doctors are willing to consider. That's really, really hard. I think not just in dysautonomia, but for anyone who's had a mental illness diagnosis, that sort of a lot of clinicians will sort of jump to that conclusion no matter what's wrong with you in the future. So do you, Jane and Charlotte, do you have any sort of insight on this from, you know, dealing with large patient support groups? How do people navigate that?
I think that's another place where coming to the support group and saying, this is sort of my unique situation. I've been labeled in the past as having these issues, and they won't look at the real problem, is a good place where you might be able to find somebody else in the group who's had a similar situation and can suggest a doctor name to you. Obviously, that's a vulnerable thing to share. So also it's good for you to know if you ever don't feel comfortable sharing something like that, you can reach out to the moderator of your local support group and ask them to share something anonymously. And we're happy to do that to make sure you get the answers you need without feeling so exposed.
Yeah, I also think when you have any kind of complex medical history and doctors are blaming things on past medical history, and you don't think that that's the right answer, probably seeing a better dysautonomia specialist will help you sort of untangle what could be the prior medical history and what is a newer, you know, autonomic issue itself or comorbidity issue. You know, the real autonomic specialists are much less likely to just inadvertently blame things on conversion disorder or functional disorders or whatever. But I have to tell you, they do see within the dysautonomia population, there are some people who have overlapping psychosomatic issues, conversion disorder issues. They're not uncommon in the general population. So they happen in our community too. So that can be really hard, right? We've had some lectures on this from the doctors. They're always controversial. Patients get kind of mad that we talk about it, but you know, people who have mental health issues deserve good treatment and support from our community too. Not just, we're all full body people, right? So we don't just try to fix the autonomic nervous system part of us. Something just happened. What just happened?
I stopped the screen share just so
I got scared. I thought the whole meeting just
so it wasn't just that question up there forever.
So that's that was I think our last one. There's a really challenging issue to deal with, no doubt, but I would say seeing a good specialist if you can. So thank you, ladies, so much for your time. Thanks for everybody who joined us this evening and asked such good questions. I think we could have a lot more discussions like this. And so our regional support groups in the different states and provinces and whatnot host virtual meetups. And these are great conversations to have on your virtual meetup groups where there's, 10 to 20 people. or you can have a really in-depth conversation about how to navigate this chronic illness life, and how do you get the best out of the doctors without sort of overwhelming them with all of our complicated stuff. So any closing thoughts from Jane?
No, I think this has really been a good conversation. And like you said, there are a lot more things we could talk about with it. But I think that kind of I always think of it as kind of a grassroots thing, or maybe even, I don't know. I just think there's so much out there of good recommendations that people have and good input. So it's really, really helpful for people.
Yeah. Any thoughts from Charlotte?
Yeah, I'm just happy to be a part of the panel and to be talking about this. I think the more we talk as a community, the closer we get to answers. And you've probably picked up by now, I'm crazy about our support groups. And I think it's just huge to be connected to a group of people that get it. So many of us feel isolated for so long. And if you are interested in helping to lead a support group or to lead a virtual meetup, I would love to talk to you more. You can send me an email, cflorez, Florez is with a Z, at dysautonomiainternational.org. And I'd love to connect you and talk more about volunteering.